this one. Imba na weka moja. Weka ile ngazi unataka. Weka active.
Well, live pictures again from Eldoret, Uasin Gishu County as the nurses dig in with their strike despite governor's warning.
The Kenya National Union of Nurses has not registered a dispute with any of the 47 county governments who are employees of the nurses. Further, no county government received any legal notice of the impending industrial action. The union, having not done so and not followed industrial relation procedures in relation to disputes, renders the strike action illegal.
Well, this is Citizen Extra. Good morning and thank you for joining us. I'm Hussein Mohammed. Governors dig in, terming the nurses' strike illegal, and warn nurses that county governments could take action against the nurses' demand implementation of the CBA. Which way forward? Also ahead on the campaign trail, President Kenyatta leads the Jubilee campaigns in Western Kenya today. What is at stake, and will Jubilee break into what is perceived as the opposition stronghold? And still on the campaign trail,
na hiyo tutaanza, manake mpango ya pesa serikali inaanza mwezi wa Julai.
Copy what you hear your other opponents. Sasa leo kule Kakamega Asimuti ya kitendawili amesema mkinichagua nitawaletea elimu ya bure. Mnaweza kuamini mtu ambaye hata hajafikiria, amesikia tukisema yake ni kupiga kama record player ati arudie yale ambayo amesemwa.
The free secondary education and the politics surrounding it, promised by both Jubilee and NASA and the campaigns, we separate the reality from the politics in the campaigns and we speak to education experts. The United Kingdom also goes to the polls today in a snap election coming in the wake of terror attacks that could shape the outcome. We're following all this for you. First, however, we begin with the nurses' strike, and mediation talks led by the Labour Ministry to end the stalemate yesterday failed as the Council of Governors and the Health Workers Union maintained their hardline stance. The governors are now threatening to take action against the nurses, terming the nurses' strike illegal. In studio, I have Andrew Mulwa, the County Executive Committee member of Health of Makueni County, was in the negotiating team. Also in the negotiating team was Joseph Ngwasi, the chair of the Kenya National Union of Nurses, and I also have Brian Mutie, a governance consultant. Thank you all for making time for us this morning. But first we begin in Uasin Gishu County. Right, to Gishu County in Eldoret shortly. John Wanyama is standing by. The pictures there you are seeing are nurses from the Moi Teaching and Referral Hospital in Eldoret that are still on strike despite all that has been happening. And I'll start with you, Ngwasi, and if we can have the soundbite by Nanok, the chair of the Council of Governors, who now says the counties should take action since the strike is illegal. What do you do? Ngwasi, I'll start with you.
As the strike ranges, the Kenya National Union of Nurses has not registered a dispute with any of the 47 county governments who are employees of the nurses. Further, no county government received any legal notice of the impending industrial action. The union, having not done so and not followed industrial relation procedures in relation to disputes, renders the strike action illegal.
Right, that is the Council of Governors Chair. John Ngwasi is talking to you. What do you do now?
Okay, thank you, Hussein. It is very unfortunate that the issue that meant the nurses to go out is not being addressed. Instead, now we start talking about the legalities of all illegalities of the strike. The nurses went out because of the CBA. It is well understood by the Kenyans that the nurses suspended their strike last December on 14th to pave way for negotiation of CBA. This process has been ongoing from January up to May, and the last minute the government has changed its position on the CBA when we had already concluded and we were ready for signing of the CBA. We didn't hear from the governor saying that the CBA had not been concluded. A big question is, when the CEO of the Council of Governors was forwarding minutes to get a no objection letter from SRC for the nurses to sign the CBA, what were we going to sign if the CBA had not been concluded? So what nurses want is the matter of CBA be concluded, and the nurses will be back to their stations as early as today in the afternoon.
Andrew Mulwa is the County Executive Committee member of Health in Makueni County, who was also in this negotiating committee. Andrew, are you sharing what the Council of Governors are saying, that the negotiations are not yet over and that the strike is illegal and that counties should now take action against the nurses?
Thank you, Hussein. The fact is that nurses called a strike in December the 5th, on December the 5th, and on the 14th of December, we were able to resolve the nurses strike with a return to work formula that clearly had stated that there are two issues that had to be addressed forthwith, and one of the issues was a recognition agreement that had to be signed with all the 47 county governments, and also negotiation of a CBA, which would be done within 90 days after the strike was called off, and in any case that is to happen not later than the 2nd of March. We, as county governments, through the Council of Governors, set up a negotiating team that comprised of representation of the county public service boards, and on the unions we also got negotiators who have been discussing the CBA from January, like my colleague has said. However, the process could not be concluded as anticipated in 90 days, and the council asked for extension of the period, which was granted by the union, and therefore negotiations have been ongoing. Up until last month, which is 25th of May, negotiations have been ongoing, and there have been substantial agreement on the issues about the CBA. However, the process of negotiation of a CBA must, before it's concluded, must have input of the Salaries and Remuneration Commission. Much as the negotiating team had agreed on the issues in principle, they presented the agreement to SRC, which was to advise whether they give a no objection or object. And SRC has forthwith rejected the negotiations. What this means, the negotiating team still stands, and what SRC has said, what you've negotiated is not acceptable before the Salaries and Remuneration Commission. So therefore, what should have been done and what should be done is the negotiating team should go back and renegotiate and come up with an agreement that is acceptable before SRC. Because without SRC approval, no CBA can be registered in court. So therefore, I don't know at what point a document that has been negotiated by two sides, one side now wants to withdraw and accuse the other of not being honest. I think we need to be serious as healthcare workers. We need to be serious as professionals and accord this process the due attention that it requires. There was no need at all for the negotiators of the nurses union to withdraw.
Right, I'll come back to this conversation shortly, and Mutia will also weigh in. First, let's over to Eldoret. John Wanyama is standing by, that is in Uasin Gishu County. Nurses at the Moi Teaching and Referral Hospital still on strike. Clearly, Wanyama, they're not heeding to what the Council of Governors Chair Nanok was saying, that the strike is illegal and that they should return to work.
Thank you, Hussein. Here in Moi Teaching and Referral Hospital, the situation is still worse, and nurses are still on the street. They are not in hospital at all, and patients are still suffering here in Moi Teaching and Referral Hospital. Nurses still insist that this strike they are on is legal, and they are fighting for what is there rightfully belongs to them. With me here are the leaders from Moi Teaching and Referral Hospital, whom we want just to talk to get a sneak peek of what is happening inside the hospital. Maybe you tell us what is the situation inside the hospital so far, since you have been on strike the 8th day now today.
Okay, the situation in the hospital of MTRH still remains dire because all nursing services have been withdrawn. So, and this, as you may be aware, is the second referral hospital in our country, and therefore Kenyans are suffering in this western region of the country.
Maybe, for how long are you expecting to go with this? And we understand now the President and Deputy President are within the region. What is your message for them?
Well, I want to implore the leaders of this country, starting from the President and his Deputy, that Kenyans are suffering, and it is upon them to intervene on this crisis so that we can have it to come to a conclusion, so that Kenyans can still continue to enjoy the services they have been enjoying all through.
Hussein, let me also talk to the chairman of nurses in Moi Teaching and Referral Hospital. What is the message you have today? Because you told us last time that students are the ones who are still treating our patients in hospital. Is still going on?
Okay, at the moment, the student services were withdrawn as we talked to the principals of both institutions, and now actually the situation on the ground is really wanting, because these are our people who are suffering, these are our relatives, and simply because SRC and our administration, they cannot work hand in hand in time so that they afford this crisis. It's really shameful to the country when we have such a kind of situations whereby as a document which was signed on 2015, it is still haunting the innocent people who are seeking for services here up to date. So we are telling SRC, today we are waiting for their final communication. If they are sincerely living with their words, and if they love this country, and if they love the people of Uasin Gishu, and they love even the top administration of this country, we want them to give a positive response to this situation of MTRH, so that we proceed to court and register our CBA, then nurses to study benefiting.
Okay, Governor Nanok is saying that this strike is illegal. What do you have? What is your message to the chairman of governors in Kenya?
Okay, the message to the chairman of governors, I'm just only telling him that let him not shield their failures using the court, because even as we are law-abiding citizens and we know the procedures of the court, we were not served this court order, and if at all the strike is illegal, then they can also produce an evidence of a court order which was legally served to the national office to us. But what I'm telling the Nanok is that hardliners cannot solve problems Kenyans are saving now. They must have to soften their stance, they must have to understand the Kenyans' cry, then come up with a conclusion for this issue once and for all. We, as nurses of MTRH, we are saying we want to do this strike today, tomorrow, until when they hear our cries, then now when we go back, we serve our patients forever. Sinivo, nurses hoye, nurses siara, nurses hoye, nurses nini, CBA, sinyo, nurses mnataka nini? Ndani. Kama buda?
Okay, thank you, Hussein. As you hear them clearly, they are still taking their stand, and they are saying they are not going to relent this war until they ensure they get their CPA well signed before they go to work. Moi Teaching and Referral Hospital has witnessed over 1,000 nurses now who are on strike, and it's very pity and very painful, Hussein, that most patients are being turned away. They are not getting these vital services from the hospital. From my side, Hussein, I have no much. We are still following up on these stories. I will get back to you once we get this information, Hussein.
Right, John, thank you so much. We'll talk to you later on, and especially to know what the county government is planning to do now that we see the nurses there have decided the strike goes on. Back to studio, Brian, I don't know how you weigh in on this matter.
Sure. Hussein, thank you so much. First of all, I want to sympathize with the plight of the nurses, and equally sympathize with the plight of the patients who are lying in hospitals without that necessary care that they so need. And I do believe that this is a negotiation that has to be, anchored in on a basis of understanding. And I want to say that ever since I started talking about matters of healthcare, Hussein, I've always maintained my stand that we did rush as a country in terms of actually transferring the responsibility of providing health care to the lower tier of government, because we have two tiers of government, of course, the national and the counties. We did this because counties had not prepared adequately in terms of setting up good frameworks that are sound enough to address the challenges of healthcare. And as you can see, this is something that has been an eyesore in terms of management and addressing the issue of health care in this country. And I'm saying this because we are just smarting, from the issue of doctor strike, which lasted over 100 days, and now we are starting to see similar, graphics that we were being treated to last time in terms of nurses now going to strike. This is a political, period, and something small normally gets ballooned because we're operating in an atmosphere which is also actually infringed by other factors such as the politics of the day. But I also want to say, Hussein, that SARA-SEREM actually released a circular that guided in terms of offered a guidance in terms of how remuneration is going to be conducted, and the nurses, doctors being included as part of the public service workforce. They also they are deemed to going to be beneficiaries, of course, of the same arrangement, because they are not different to another public officer. And I think from this month, all public officers, all government officers are going to benefit from that increment. I do not know at what point this was bypassed, because nurses also being part of this category need to understand that they are also going to benefit from this. I think the discussion should be anchored on how they are going to actually, infuse the negotiation that they had already kickstarted and what the SARA-SEREM Commission is actually offering from this month. But I also want to say Article 187, Hussein, is very elaborate, when it comes to, matters of transferring responsibilities from one tier of government to the other. The health docket has been grappling with the issues of management and misunderstandings, and therefore I think, according to this article, it provides that framework where an arrangement can be done in terms of an agreement where if you feel that this docket is not productive in terms of where it's placed, it can be actually transferred from that docket, from that tier to another, so that it's effectively, administered and it's able to actually live to its billing. But essentially, when you look at Article 41, of course, it gives the nurses the rights, of course, to picket, to belong to labor movements and all that, and ensure that their bargaining power is actually, consolidated together, so that they are able to speak in one voice. And if they are not going to be able to gel themselves in a way that their issues are addressed in a way that towards the line in terms of transparent and accountability democracy. I think we are losing it here, because while the CEC for Makueni, Dr. Mulwa, a man I do respect because of the good job that he's doing in Makueni, I do agree that he has said that they had already engaged that gear in terms of negotiating with SARA-SEREM, and they never had a breakthrough in terms of what is supposed to go to the nurses. So, therefore, there is nothing concrete in terms of what they are supposed to receive, in terms of that finality, in terms of a document that should give something. And therefore, if that's not existing, I think nurses are not in order to go to a strike when they know that the document never came to a finality in terms of agreement, Hussein?
All right. Let's cross over now to Kisumu County. Let's find out what's happening there. That is at Jaramogi. Oginga Hospital. We'll cross over to Kisumu shortly. Andrew, you've heard from both panelists here, and you've heard from especially, Joseph Ngwasi, I'm sure you've heard from Andrew Muller what he was saying. The question is, and Andrew, you can also weigh in, were these negotiations conclusive, or was it supposed to wait for the no objection letter from SRC? From where you stand, Andrew?
Hussein, and we were having the same problem with the doctors' CBA from December, which lasted 100 days, that a CBA that had not been registered, had not been approved by SRC, was being registered in court, and it was impossible. We do not want to go to repeat the same problem that we had. So therefore, a CBA that has not been approved, has not received a nod from SRC, cannot see the light of the day.
So but in the negotiations, did you conclude?
We had concluded to the point of negotiation. But conclusion can only come when SRC has given a nod. Then it is at that point that we say, as negotiating team, what we've discussed has gotten a nod. Therefore, we can call all the other parties that we have been representing to come and sign the document. So therefore, it is discussions that are ongoing. The conclusion of the CBA can only come when it gets a nod.
I don't know what you think, Mutia. I don't know what you think, Andrew, but certainly first let's cross over to Kisumu County. Okay. Let's find out what is happening there. NASA strike still going on, I believe. Laura Achieng is a reporter there. Laura, what's the latest there?
Thank you very much, Hussein Mohammed. We are at the Jaramogi Oginga Teaching and Referral Hospital, and the situation here is actually dire. This the outpatient delivery area, and it's normally a beehive of activities, and as you can see behind me, Hussein, the benches here are literally empty. The patients that are coming in here are literally being told to seek alternative places where they can get health services. And if I can speak to one of the women here who has actually been shunned from the services, so please, if you could tell us, umefika ukaambiwa?
Tumeambiwa twende private hospital kwa saizi madaktari wamegoma. Sasa wanasema mpaka mgomo ishe ndo wanaweza endelea kuhudumia watoto. Na sasa unapata maybe mali umetoka umetembea footing mpaka hapa. Hiyo pesa kwenda private hakuna. Sasa inabidi turudi kwa nyumba kwa sababu una otherwise.
Yeah, Hussein Mohammed, these are some of the people who are actually confident enough to speak to us on camera, but the rest of the people have actually been walking out here. They've been shunned. They've been told to seek alternative places where they can get health services. And we were earlier on speaking to the Director of Clinical Services here, Dr. Okoth, who was telling us that some relatives are actually removing their sick from the wards because there are no nursing services being offered here. And of course, our efforts to get in touch with the CEC of Health of Kisumu, Dr. Lucy, have been futile. He's not picking our calls. We wanted to ask him on what they're going to do as a county following Governor Nanok's directive yesterday to take stern action on the striking nurses. So of course we'll be following up on that story, and of course we'll be updating you on the latest from this front. Back to you, Hussein.
Laura, thank you so much. We'll be crossing over to Kisumu later on to find out how the situation, whether that situation will persist. Of course, you know the governors are saying the strike is illegal, and county governments should start taking action. Yes, Muti, you say something else.
Of course, thank you, Hussein. I think I do concur with the provisions that are given under Article 43 and 42. Of course, they do emphasize on the need to provide, highest standard of healthcare to the citizens, while at the same time in Article 41, of course, highlights the need for also doctors and medical practitioners and another person to be remunerated in a way that is actually, in tandem with the provisions that are reasonable. But again, if only Dr. Andrew can be honest with us, I think he knows very well that the timing of this strike is very suspect. Remember, we are operating, within a very tense political atmosphere, and the timing itself being suspect. I think Mulwa knows that he's a political, practitioner. He had some ambitions in terms of the politics of the day. and I don't know at what point he shelved them. And I do believe that if you allow politics to creep in terms of service delivery, then you are affecting millions and millions of Kenyans who are looking at you as the sole provider of that hope that they would want to see. But again, if you do engage on that, then you are doing so much disservice to the people of this country, because when you look at the timing, Hussein, it's only 2 months to the elections. This is the time that doctors are looking for that kind of sympathy from the political infringement that normally creeps in when it comes to such an issue. Politicians are going to take over. They are going to ensure that they infringe on this and balloon the whole situation to look so mismanaged and so hard to tackle. And therefore, to me, I think it's suspect and it should not be allowed at this time.
Hussein, yes, I think, and this needs to be very, very clear, that even as the Council of Governors registered a dispute at the Labour Ministry, the dispute here is we formed a team that is supposed to negotiate the CBA.
Yes.
And part of the team has withdrawn from the negotiations.
At what point? At what point?
At what point did they withdraw? You think that team withdrew? At what point did they withdraw? They withdrew at the point that they sought advice from SRC. Because it's a process. It is at that point where we have a point of departure. Our departure has never been a commitment of the counties to sign a CBA. There is a negotiating team that on the government side, on the county government side, that is ready to continue negotiating and conclude this process where they left it. And I really want to make this also very, very clear that as at Sunday, as the CEC for Health in Makueni and the chair of CECs for Health in the country, we had never been served with a strike notice. As far as we are concerned, we have been waiting for these negotiations to get concluded. We had a meeting, 2 weeks ago, and we've been waiting for this process to be concluded. And once SRC advice was not positive, I think the most prudent thing would have been the negotiating team come back, sit down, and ask themselves, okay, we need to agree. I think we need to put things clear. We need to put things clear. But I'm wondering how the union withdrew from the negotiation when the Council of Governors, when the government, our employer, was asking for a no objection letter to pay free for signing of CBA. Were we to discuss CBA but the no objection letter? I think the union had already concluded the negotiations and was waiting for sign. I think if the union refused to sign the CBA, we can now see that the union withdrew from the negotiation because the union was only waiting to sign for the negotiation.
Let me say this, Hussein.
Let Andrew ask that question. You asked that question to Joseph?
Yes, to Joseph. Is it possible to conclude a CBA without the advice of SRC? Yes or no? Yes or no? Is negotiations and being concluded. But without the advice of SRC, can we have a CBA signed?
It cannot be. No, it's not possible.
So
I do agree. I do agree with that.
But Andrew, I mean, this was a negotiating team.
Yes.
SRC deals with who? The nurses or the employer?
SRC deals with the employer.
Exactly.
So the employer tells the SRC, we have negotiated with the union on these terms.
Good.
And this is our agreement. What is your opinion? If they give a nod, then we go forward and sign. If they say no, like they did, we go back to renegotiating and get an agreement that is...
If you're going back to renegotiate, Andrew, that's you now saying that negotiation, the first one was over, isn't it?
Yes. It is over in the sense that we had a document that was agreed between the two parties. But we cannot have a signing of the CBA minus the approval of the SRC. The SRC did put and advised in February. They constantly advised the county public service boards and the Council of Governors before the negotiation of the CBA. Now we are asking, if you had received this advice from the SRC, were we being taken for a ride during this period that we have been...
You received this advice because SRC has said that. Andrew, did you receive this advice? They kept on telling you should not go beyond certain limits, isn't it?
We did have received advice from SRC, and the advice that SRC was giving was broad, in the sense that there was a job evaluation. As you rightly said, all the employees of government will from July 1st, after the job evaluation, will get new salaries, new pay packs from SRC. And SRC advice was, we have already done this exercise. So as you continue negotiating, you should negotiate within these frameworks. And the fact is, we had an agreement with the union.
But that agreement had gone beyond the limits that SRC had given you.
Had set.
Yes.
And therefore,
so that is why Joseph is asking you, why are you taking them for a ride? Why would you go with a negotiation and give allowances? And we're going to look at those allowances. We can look at them on graphics. Why would you negotiate as the employer on the basis of allowances that you know SRC has said are beyond the limits? That is why Joseph is saying you're taking them for a ride.
That communication may not have clearly been passed to the negotiating team. I am sure the negotiating team did everything in good faith, and they probably did not receive that advice in advance.
But you're saying you just said SRC advised you.
I want to also mention something else, Hussein. When the negotiating team concluded the discussions, they did not actually refer back to the full Council of Governors for them to approve. And probably it is at that time that issue of there was an advisory, they directly engaged the SRC, which is something that I would say is an internal administrative issue, but it does not necessarily affect the
I think my friend is confirming that there is a failure from the government.
From the union.
From the government, and from the government, because the union was have negotiated with a credible team from the government, properly advised by the SRC.
We have come even such
we have agreed.
Give him time to talk.
Outcomes we agree. We have agreed on this amount. You say yes. We have agreed on this amount. Say yes. And now, after conclusion, now the figure becomes mind-boggling, as the governor was putting.
Do you know why there exist these commissions? These commissions exist so that they may guide.
But you are guided.
Tell me to go
okay, let's cut to the chase.
I am given broad terms.
Okay, let's cut to the chase here.
Yes.
Andrew, very briefly, if you can just answer this very briefly, because they also have questions for Joseph.
Yes.
You were guided by the SRC, and you were told don't go beyond certain limits. You went ahead as the employer and you went beyond those limits. And that is why Joseph is telling you, or is asking you, why are you taking them for a ride?
The limits that were given, Hussein, were not in figures. The limits were broad guidelines that we should follow as we do negotiations. We are not on figures.
But we are negotiating figures.
No, these are like the nurses wanted the nurses allowance to be called health allowance. These are the broad guidelines that we are told.
So there are no figures.
Uniform, you need to consider not giving allowance for uniform. Do this. You know, were broad guidelines that were not monetary. That's why SRC and the National Treasury must come in before any CBA is
Joseph, either way you knew
because we were given broad guidelines for negotiations.
Joseph, you knew either way when these negotiations were going on that ultimately SRC was going to give an objection letter, isn't it?
We didn't expect that. That was the last thing that the union expected.
Did you know? Because governors are saying, and we've seen a statement from the Council of Governors saying, after the negotiations, they will wait for advice from the SRC and try to get a no objection letter. You knew that was a step, isn't it? Ultimately, did you know?
In law, it is proper that the SRC issues a no objection letter before the CBA is
so why would you go to strike before SRC issues a no objection letter?
We had already concluded negotiations.
And you said in law negotiations end after SRC have given an objection.
Bearing in mind that we are negotiating with a team that had been properly advised by the SRC, we didn't agree to sign the CBA on 11th of May. That day, the Council of Governors changed that position. They did not forward the final agreement to the SRC. Patiently enough, we decided to postpone the date again to give the Council of Governors a chance, second chance, to forward the same to the SRC, only to convene our officials on second, the date that we had agreed to sign the CBA, to realize that documents had not been forwarded. Instead, the CEO was writing to the SRC on 31st of May, expecting to get a reply on 1st, which is public holiday, to get signed the CBA on 2nd. Honestly, the nurses are being taken and have been taken for a ride for a long time.
Thank you so much, Hussein. I think we are getting some sort of confusion here because my brother there, Joseph, is saying that as early as May they had already, given notice, and you realize that by May SRSRM had already pulled out a circular in terms of the guidelines that they are going to offer all public officers, and that was actually to take effect in July. This is the month which is coming. But I also want to say this strike, which does not have the blessings of the COG, the highest governance structure on the land. I think Mulwa, who also belongs to Makueni County and the tutelage of Kivuda Kibwana, who is a very core member of the COG, I don't know how he went ahead and deviated from the same principles that Kivuda holds, that the strike is illegal. I don't know whether it's a friendly fire or is rebelling against the principles of the top hierarchy of Makueni County. But also, wait a minute. But I also believe that while we do need to understand the whole issue, we also need to iron out and stop confusing Kenyans and misguiding them. There is the SRSRM Commission, which actually is on record that all salaries will be actually harmonized, and everybody who earns that title of a public officer or government officer will be actually a beneficiary of the.
So what was the point of these negotiations?
I think the SRSRM report of harmonizing the salary does not set aside Article 41, Section 5, which allows the union to negotiate for a CBA.
Hussein, the fact is, rightly, with the harmonization of salaries that was expected in July, the best case scenario was to wait the July harmonization, then we start negotiating CBAs forthwith. But
after
because
July
of the pressure, because of the CBA, but they led the began in 2013.
Okay.
And from 2013, this is an issue that has been crippling the health sector. And with the industrial action of December, then because this is an issue that has been of concern to the nurses union, they would not be patient enough to wait, and that is why we are here. And one thing that continues to disturb me is when patients in Makueni, in all the 47 counties, are suffering, while no county government was served with a strike notice about the strikes that we have today. We may talk about dispute in negotiations.
Was that right, Joseph?
But the Employment Act is very clear on the procedures.
Did you give any notice?
Recognition agreement with 47 counties. Why didn't you find it prudent to serve us with strike notices? That we only discover there's a strike on Monday and that we have never been served. It's an illegal strike.
I think we are deviating from the topic. We are deviating from what nurses want. My colleague here has just said that the CBA was to be negotiated after January. What were they doing with us?
After July.
If they knew that they are saying that they were to implement the SRSRM report and then negotiate with us, what have we been doing for all that period?
And that's my opinion.
Are we taking Kenyans for a ride?
Best case scenario would have been, let's wait for the harmonization. We see what we get from the harmonization, and once we have the harmonization, then we can now say.
But you negotiated. That's what Joseph is saying.
The issue is, Hussein, when Kenyans are suffering. In December, Kenyans suffered for 9 good days without nursing care in the whole country. So, will we allow Kenyans to continue suffering because I tell the union, wait until July? No. We have to do something as government. We have to do something. And our negotiation, we expected our negotiation.
Whatever was done clearly has not worked up to now. So very briefly now, as we wind up, for both of you and even Mutie, how do you solve this now? What do you do?
Yes,
what do you do? And let me start with Joseph Gwasi, because they're the ones on strike currently. The negotiation talks led by the Labor Ministry. What do you do? How can this be solved, Joseph?
Okay, it is our humble appeal that let us face this thing soberly. Let the government come clear and agree with the union and express that goodwill as the nurses have expressed. because nurses of this country have been very patient. Look at the issue of Moi Teaching and Rivaro. That is a national facility. They have a CBA which is negotiated and signed, but at the end of the day, the employer refuses to register the same in court. Therefore, we are appealing to the government of Kenya. Let us respect the nurses by according them their rights.
What will it take to end the strike?
What our irreducible minimum is that we want a signed collective bargaining agreement.
Regardless of what SRC is saying, that COG must clearly show where it's going to get that money from. Regardless of what they are saying.
Yeah, we are saying we want a collective bargaining agreement signed.
It doesn't matter.
It was discussed and agreed. If we are being taken serious as healthcare providers.
But you're still going on to participate in the mediation talks led by the Labour Ministry?
We don't have a problem. What we want is we concentrate on the subject matter that meant the nurses to go out.
Okay. Very briefly, Andrew, what do you think should be the way out of this?
Hussein, we must separate two issues. There is the issue of CBA negotiation process, which we have a negotiating team that should come back to the negotiating table and finalize the process. Then the other process is the process of the strike. As far as I'm concerned, the employers of the nurses in the counties are the county public service boards. And as far as I'm concerned, there is no industrial dispute between the county public service boards and and the Kenya National Union of Nurses that has been registered. And therefore, I am going to deal with the nurses of Makueni as employees of Makueni County Government, and I am going to deal with them as in the manner that employees who have absconded duty are dealt with.
So that's how you're going to solve.
We are going to get mechanisms of having them either go back to work,
right,
or get get disciplinary action on those who are out of work.
So that is the only way to solve this.
So the issue is the strike. Saying to me remains illegal, and therefore we cannot continue to discuss as an illegal strike that has not been properly served.
Okay,
and we cannot further this debate when Kenyans are dying, Kenyans are suffering.
Okay.
Yes.
Hussein, I think the Terry has put it very clear that the employer of public service, of the nurses, is the county public service boards and the public service commission in the national government. The CEO, Council of Governors, is on record to have written to the Public Service Commission inquiring whether who are supposed to sign the CBA. That just means that the county government does not know the employer of the nurses.
The question was whether the county public service board or the CECs and the chief of staff, and they got a response. That was an administrative question.
Brian, finally.
Thank you, Hussein. I just want to advise my friends that you do not negotiate while you are holding a gun on your other party, and you do not negotiate while you are hiding some of the cards under the table. You bring an open-minded approach when it comes to negotiation, and therefore threatening nurses with a strike, with a sack, is not the right way to approach issues. Consequently, we also need to understand that Article 43 gives the rights to Kenyans to have that highest standard of healthcare, and by subjecting them to this kind of suffering because of confusion that seems to be coming from the officials and the negotiating team, that's something that needs to be taken and hired out, because as rightly put here, Saraserem has something to offer for the people, for the nurses, as included in the provision that she circulated, and we seem to be offering a lot of pressure to this person in the name of Saraserem, in the sense that we seem to put her between a hard and rocky situation, where while on the other hand she has something for you, the other hand you're pulling her hand, demanding for something which is not actually encapsulated in terms of a legal framework. Having said that, I think this country is still a great country, and the timing of this strike being suspect as far as I'm concerned, I think nurses need to go back to their work, and the negotiating team led by Dr. Mulwa sit down with Saraserem and the other stakeholders and negotiate the way forward, because this country cannot afford other days like we saw with doctors, where Kenyans are suffering at the expense of, you know, few people who are not agreeing on some few issues that they ought to do agree.
Alright, it's a problem that still persists in this country, and we hope for a speedy solution to this matter. On 22422, somebody says, may I ask this question? They are saying the strike is illegal. Which court of law declared it illegal? I think Andrew responded to that, or he has explained that, why they think it's illegal. And Omoga in Garissa says, Hussein, tell Bernard and COG to stop exposing Kenyan patients to untold suffering and death by shifting goalposts and having unnecessary blames. Sign the CBA. I bet Omoga could be one of the nurses or a viewer of Citizen TV. Thank you so much for your comments. Keep talking to us, 22422, and you can text us, and you can also tweet us using the hashtag CitizenExtra. Thank you so much to our guests making time for us this morning. Andrew Mulwa, the County Executive Committee member of Health in Makueni, Joseph Ngwasi, Chair of the Kenya National Union of Nurses, and of course Brian Mutie is the governance consultant to stay with us. Thank you so much for making time for us. We're taking a short break now. Ahead we speak to Hassan Mugambi, who is at the Administration Police Training College in Nairobi. The Interior Cabinet Secretary Joseph Kaiseri currently leading a memorial mass for AP officers who have lost their lives recently in Al-Shabaab attacks. We also will be talking to Jackie Maribe on the campaign trail, because Uhuru Kenyatta leading the Jubilee team in Trans Nzoia today as the NASA team heads to the coast region. We're back after this.